Hello, you're watching this video because you or a loved one is suffering from a very serious health condition. Severe low back or leg pain, numbness, tingling, burning in the leg of the foot, sciatica, sharp shooting pains, herniated, bulged, or degenerated discs. Well, we treat this condition both metabolically and neurologically, and I'm here to tell you that no stone is left unturned to determine the exact cause of your low back and leg pain and other chronic symptoms. My name is Dr. Stephen Moleski. I'm a chiropractic physician. I've been in practice for over 30 years. I'm located in Tallahassee, Florida. People ask us, well, what is your approach to low back and leg pain? The answer is that we use specific metabolic and neurologic testing and all-natural treatment protocols. No drugs, no surgery. Low back pain and leg pain can be caused by nerve irritation, disc problems, autoimmune responses, metabolic disorders, or nutritional deficiencies. Over the years, I've had people come in and say to me, they knew someone that had a back surgery and they were no better afterward. Well, that's because, an MRI can show a disc problem, but that may not be the only problem going on there. There may be other complicating factors occurring. So it's very important that we run through a very thorough diagnostic workup to rule out other causes of the back pain and leg pain. We run through 6 panels that will help rule out autoimmune or metabolic problems. The first is a complete metabolic panel. The second, a complete thyroid panel. The third, a complete blood count with differential. With these tests, we can assess all your organs, blood cells, and gut function. Now, I know what you're going to say, Doc, I had all those tests done, they're all negative. Well, these tests are very thorough, and when a blood test comes back, it comes back with an average range, maybe 10 to 100. And that's the average value for the average person that has a blood test done, which is a person that's not really very healthy. Well, in a healthy situation, there's a much tighter range, a functional range. And we want to see where your values fit into a functional range, because oftentimes you're going to get false negatives on these outskirt areas of a lab result. So it's very important for us to run all these tests to see how your body's functioning. The next test is sensitivity testing. This tests for sensitivity to gluten, eggs, milk, soy, and yeast. If you're sensitive to any of these foods, it could be causing your problem or greatly exacerbating it. Symptoms of a food sensitivity would be constipation, loose bowels, indigestion, bloating, chronic pain, or fatigue. The best way for us to determine if you're sensitive to any or all of these foods is to run this test. The next are immune panels. You could have an autoimmune response going on. And as you know, this is a situation where your immune system actually attacks your own body. It can attack the nerves, the connective tissue, ligaments, organs. Not a good situation. Your immune system is balanced. You have a Th1 and a Th2, and they should be in a balance. If we run these tests and find that one is elevated, that's a sign that there's an autoimmune response going on. We need to find the cause of that. Now, you can be infected with parasites, protozoa, amoeba, viruses, bacteria, or toxic heavy metals, just to name a few. It's very important to run the test to determine if you're suffering from any of these. The final test is for inflammation. We can check for an inflammatory response going on in your body by checking the C-reactive protein and homocysteine levels. Most people with acute or chronic pain syndromes have an inflammatory response going on in their body. That's the metabolic side. On the neurologic side, we do specific neurologic treatment based on specific functional neurological testing. Now, we may find there's an imbalance in your nerve system. And this is kind of like having a short circuit in your car's electrical system. Your car's just not going to run right. Well, your body's not going to run right if there's a short circuit in it. So the nerve system needs to be balanced. If we find that there's an imbalance, we do specific neurological protocol to balance it out. It's called brain-based therapy. A couple examples. Vibration. Vibration is very good for stimulating your cerebellum. And your cerebellum is a part of the brain that controls your postural muscles all the way down your spine. If this part of the brain is not firing properly, it can cause spasm and cause the bones in the back to lock up. And when they lock up, they put pressure on the discs and can cause disc problems. And the majority of people that come into our office will say to us that they don't know what caused their problem. They didn't have a fall, heavy lifting, accident, anything like that. And a lot of it is neurologically based. So we may run vibrator on the right side of your body to stimulate your right cerebellum. We may use olfactory, auditory, or visual stimulation as well. We use cold laser therapy for this. Cold lasers is a great therapy. Hot lasers are high-powered lasers, are like used in surgery. They cut tissue. Well, cold lasers are on the opposite end of the spectrum. And what they do is they actually wake tissue up and cause the tissues to function normally again. They reduce inflammation. There's no side effects and no pain involved with it. We may apply the lasers right to the foot, leg, or low back. You may never heard of this type of therapy. It's only been around in the United States since 2002 when the FDA cleared it for use here. But it's been used for 50 years in Europe. Another treatment is called non-surgical spinal decompression. The joints in your back, there's discs, and the joints can become compressed and put pressure on the nerve. This is a medical device that actually helps to pull the pressure off those nerves. It's very effective, very sophisticated. It also adds a slow stretch to the muscles and ligaments, which helps to fire the nerve system to balance the whole nerve system out left to right. So in summary, we evaluate you metabolically, treat you metabolically, neurologically, and treat you neurologically. No drugs, no surgery. So at this point, we need to ask you 3 questions. The first, how has this condition affected your finances, your job, your relationships, your life in general? The second, where do you picture yourself in a year or 3 years from now if you don't get this taken care of soon? And the third, what are you willing to do if we can help you get better? And by that, what I mean is, are you the type of person that will take responsibility for your health and follow directions to the T? Are you willing to make lifestyle changes, exercise, avoid certain foods, take certain nutrients, clear time in your schedule to get the treatment that you need? We don't accept all cases, only those we think we can truly help and those we think that will cooperate with our treatment recommendations. If you're that type of patient, you should call us for a personal consultation and review of your condition. You can call us at 850-878-5636. Or if you need more details, you can leave your contact information at the bottom of the page here, and we will mail you more information. Thank you.